the screen or part of it on the screen. All right, who's ready? Feel free to put in the chat where you're from, what you want to get most out of this presentation. And know that everything I say is not going to be new to you, but some things will be, or maybe I'll say it and you'll see things in a slightly different perspective, right? Okay, so let's look at the importance of a thorough assessment and evaluation, not the typical HMO, PPO style. Oh, where does it hurt? It hurts over here. Oh, how long has it been hurting? Okay, here you go, on your way. We want to get beyond that. So we need a thorough assessment, and we need to identify what foods they may not be doing well with. So people say, what do I eat? I keep hearing all these things. I should avoid this. I should avoid that. What the heck am I supposed to eat? Well, that's where we are going to be able to talk about it. I call them religions, food religions. And how do we use those and know which of these food religions is best for this person? Personalized nutrition programs is paleo and plant-based and keto and gluten-free and macro and so many more. So we've got ketogenic, but we can do a ketogenic in a healthy way, or we can do it in a not so healthy way. Eating bacon and eggs for breakfast every day of the week is the not so healthy way to do a keto. But you can do a plant-based version of it, a plant-strong version of it. And then people say, oh, let's do a plant-based diet. Well, you can do a plant-based diet that's going to hurt you too. French fries are plant-based, right? You can eat French fries and potato chips all day. I know someone, she's a tour guide we met in Costa Rica, vegetarian, been vegetarian for many years. She eats mostly potatoes, like potatoes, breakfast, lunch, and dinner, potatoes. She doesn't like vegetables. She doesn't like fruit. She eats a lot of potatoes. Is that a healthy, balanced, plant-based diet? No, just because somebody comes in and says, oh, I'm on a keto diet, I'm really healthy. Or, oh, I'm on a plant-based diet, I'm really healthy. We get to ask the questions and we get to dig in, okay? So then we have the free diets, right? Gluten-free, casein-free, lactose-free, sugar-free. Then we have the low diets, right? We need low FODMAPs, low oxalates, low phenols, low salicylates, amines, histamine, sulfur, and lectins. What's a person to do? What's left to eat? Let's show you how you can identify for a person which of these diets or which combination of these diets is going to work well for them. So let's talk about food sensitivity detection. A lot of people want to know, what's my favorite food sensitivity test? And I say, I haven't met one that I've gotten along with yet. There may be some out there, but I think a lot of them give false positives. A lot of them give false negatives. And a lot of them give people the assurance that, oh, I can eat that. So there may be some things that are tested on those tests that the person doesn't have an immunologic response to. They don't create antibodies to it, but it's still not agreeing with them. And that's why we're going to talk today about oxalates and all the other things that are different ways of detection. And you don't run a, 142 food sensitivity panel and find out that they have oxalate sensitivity. That's just not something that's done. So how do we look at that? I do a lot of questioning, and just asking people questions like face to face, that would take a really long time. And I'd have to have a 4-hour intake with somebody. And that, I'm not going to charge $50 for a 4-hour intake. I'm going to charge a hefty fee because that's a lot of people I couldn't see in that time. Correct? So we want to be able to do this in a faster way. So I have a form, and the form says, answer these to calculate your likelihood of food allergies. Actually, I need to change that to say food allergies, intolerances, and sensitivities, because they're all a little bit different in that regard. And then we're going to calculate a score, how likely they are. But here's the thing. There's so many symptoms that can come from a food intolerance, right? It could be kidney stones. It could be vulva pain. It could be gritty eyes. It could be snotty nose. It could be, mucus, coughing, etc. So I have them fill out these, and I have them broken down into things that are related to histamine type reactions and things that are related to gut reactions. So I have them choose, is this something that doesn't bother them at all, occasionally, more than occasionally, and all the time? And we come up with a score for each section. And then we go, okay, all of that. the total that they could have had if they had 3 on every answer was 99. What is their score, right? Is it 50 out of 99, which is almost 50%? Is it 20? Is it 10? Is it 98? So we figure out how likely are they to have some food intolerances. And then we do this. This is a shorter one. There's only 27 points total, but here's a few other questions that we ask. And then we total it up and we figure out, right, the likelihood of them having food intolerances. Is this 100% accurate? Of course not. But we're like a detective pulling together the clues. Does that make sense? And then I have another thing I do, which is food frequency. How frequently do they eat certain foods? Because if they're having certain symptoms, like whether it be a rash or whether it be sinus problems, and they're having that daily, and they eat, I don't know, bananas once a year, is it likely that the bananas are causing their symptoms? Probably not, right? But the things that they eat on a regular basis are more likely to be causing their issues. So we have them write, never, once a month or less, one or more time, once a week or less, twice a week, 3 times a week, 4 times, all the way up to daily. How often are they eating this? Usually it's the foods that they crave and they're liking the most that they're having a problem with. And even if they don't crave them, like if they have oxalate problems and they're getting gritty eyes and they're feeling, pain and they see grit in their urine or other symptoms, it could be oxalates. And then you ask them, what is their eating habits like? How often are they eating spinach, rhubarb, chia seeds, almonds, and other foods that are high in oxalates? Is this making sense? That's why I say a comprehensive assessment, not just running a test, not just looking at genes, but running specific assessments. Is this making sense so far? So I gave you some charts of what are some of the symptoms related to high oxalates, right? Headaches, vulva pain, you feel like I have a UTI. I always feel like my urine is burning. I feel like I have to go pee all the time, but there's never very much there. The doctor does an infection test. I don't have a UTI. What could that be? It might be an oxalate sensitivity, right? Muscle pain, joint pain, bladder pain, poor bone health, sandy stool, eye pain. All of these can be related to oxalate sensitivities. And they maybe have said, I heard this doctor talk about oxalates. I think I have it. And they don't have any of these symptoms. Well, likelihood is probably it's something else, right? Salicylates. These are protective compounds made by plants. Most of these things are. Some people are super sensitive to them, and it can interfere with thyroid function. So when you have somebody who comes in with all the symptoms of thyroid, and they're either on medication or the doctor only tested TSH and said, you're fine, you don't have a thyroid problem, even though they have the symptoms, then this salicylate imbalance or intolerance might be part of it, right? Estrogens can lower salicylate tolerance, so you can't have as many if they're taking birth control pills, right? Or they're taking estrogen replacement. Can activate mast cells. Mast cells are these cells in all these particular types of cells that explode out with histamine, right? They call it like the runny nose and the reactions. And it can make FODMAP sensitivity worse. And we'll talk about what each of these is and give you some tools that you can use to try to help people with this. So FODMAPs, right? Fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. It's basically carbohydrate intolerance. It's not just gluten intolerance, it's carbohydrate intolerance, that people are not able to handle these types of carbohydrates and they need to go on a diet that's low in them. What symptoms do we get? Well, it could be lots of things. And generally it's related to the gut, right? Gas and bloating and diarrhea, constipation, burping, abdominal pain, and they may have been diagnosed with SIBO because they eat and they get bloated immediately. Make sense? Have you seen patients like that? Who's seen people like that or experienced that? Yeah, it's very common because of the gut bugs. It's the bugs that are growing down there that we need to eradicate or balance out. Then there's histamine. So many people, histamine. I've seen summits, whole summits on histamine and mast cell intolerance. That's a type of amine that is released from breaking down foods. Okay? The body produces them when it's exposed to something that it's trying to protect you from, Like some people are allergic to grass or pollen, and all of a sudden at certain times a year, the histamines are produced and they get this reaction. But there's also histamines in some foods. So people who have this histamine sensitivity need to, at least temporarily, slow down on their intake of these. And they cause reactions that we typically associate with redness, rashes, allergies, right? Dizziness, rashes, redness, allergy reactions, even headaches and fatigue. And then we have lectins. Who's heard the doctor, the great doctor who talks about lectins all the time, as if they're the biggest poison to the planet, right? It's the only thing, and just get rid of lectins, they're all bad. They're just sugar binding proteins that are found in foods. It's a natural part of the food. In excess, it can be dangerous. In excess, they can be problematic. Like if you eat raw kidney beans, they're super high in these lectins and your body can't absorb it and it can cause problems. But the amount that people have in normal intake is oftentimes not enough to cause symptoms unless there's some leaky gut or some genetic tendencies, et cetera. Right? And they're there to protect the plant. It's protecting the plant from having, this elimination of species, right? So they create this. It's resistant to the human digestion. So when people eat them, they can have digestive issues. And we oftentimes produce antibodies to them. And here's a chart that talks about some of the problems that you have. If the lectins are getting into the bloodstream, and if they're too high, it can cause problems with insulin and insulin resistance. It can also be found, these lectins are found in a lot of the foods that we think of as the top allergens. So maybe some people who have a problem with gluten, dairy, soy, corn, eggs, peanuts, those sorts of things, tree nuts, those are common allergens. It might be because of the lectins, but it might be because they've created an immunological. We have to figure that out. They contribute to urinary tract infections. So we may think, oh, this person is lectin sensitive when really it's oxalate, or that they're oxalate sensitive when it's really the lectins. So it's really doing that complete history. And it can contribute to anemia if it's very high. So if you're sitting around eating raw kidney beans, who's ever eaten a raw kidney bean? Anybody? I don't know how you even do it, right? Unless you flour it, make a flour out of it. Although you might do that. I've seen people make flours out of things and maybe mix it up with some nut butter. I don't know how you would eat raw kidney beans, but don't do it. Don't try it. And if people are thinking about it, or if people are real excited about being on a raw food diet, which I love raw food diet. I primarily eat raw foods, but I don't sprout kidney beans and try to eat them. I don't, right? Because it's just not a good thing to do. So high in lectins. So this is a chart, and I'm going to give you this chart. I'll give you a PDF, not a PDF. I can't remember if it's a PDF or it's a doc, a Google Doc or whatever, but it's a chart that we put together with a lot of research, and we put all the different food religions up at the top. And it's, does this person need to follow this diet up here? Low FODMAP, low SCD diet, a GAPS diet, low histamine, low oxalate, low phenols, it should say low salicylates, low sulfur, low lectin, low nightshade, low amine. So all these different types of diets that you've heard of, does this person need to follow it? So it goes down. There's another 2 pages of symptoms after that. And you can go through this and you can say, oh, this person has headaches and they have all these different symptoms. And you can look to see what it might be. If somebody has like 5 out of 6 of these reds here, under oxalates, they probably have some sort of intolerance right now of oxalates. But if they don't, they're green, but they have these problems over here with headaches, vulva pain, but they also have joint pain and bladder pain, et cetera. Some of these might be related. So the yellow means that symptom might be a sign that they need a low lectin diet. The red means that probably need to do it unless they just have one symptom, right? We go by symptom clusters. And if it's green, it's probably not related. Is this making sense? Yes? No? We give this out as part of our nutritional endocrinology practitioner training in the food sensitivity module. We also do it as part of our empowered self-care. So some of you may have seen it before when we take people through the food intolerance piece. So you're going to get a copy of that. You like that? Sound like a good thing? Yes? No? Maybe? Yeah. Okay. So let's talk about some of the other ways we look at this. Let's talk about some of the genetic markers and some of the lab tests that may indicate what you need to do for people. I came up with this statement and people liked it, so I quoted it. Genes tell us how much we can get away with in our daily choices, right? If you have really great genes and you have great detox pathways genetically, you're going to go, well, I can get away with a little coffee here and a little sugar there. But if you don't, you can't get away with much. Like I have tons of genes that predispose me to having blood sugar problems. I can't get away with it. Even dates will raise my blood sugar. There's no way I can eat M&Ms like I did when I was a kid. No wonder I got my tonsils out and had infections all the time and had a bone tumor when I was 9 years old, right? And all these different things that I had, and I never associated it with food until I learned better. And now I'm super careful about it because I don't want to, I don't want to live my family history, unfortunately, which is early death from heart attack or diabetes complications or cancer, right? I don't want to live out that, but I can control that by my choices. And that's where we want to help people to see. And I find that when you look at people's genes and you tell them what their predispositions could be, they're more likely to listen to you with how do you prevent that from happening? Oh, you have the ApoE44 gene. That means that you're at a high risk of Alzheimer's and cardiovascular disease, stroke, heart attack, etc. And here's some of the things we can do because genes are about 5% or less, and your epigenetics are the rest of it. So it helps people to know what they can get away with, what they need to do to protect themselves and live a long and healthy life. So I'm not going to go through each of these genes. We'll go through them in more depth when we do our 3-day event in June. And we'll take some time with these and how you can look at these and where you find them. But these are some of the genes. If you want to take a picture, feel free to do that. And this is just some of the genes related to oxalates. I have a summary one at the end too. These are some of the genes that are related to salicylate sensitivity. So if people have these genes, if they're talking all these symptoms, you go, salicylates, let me look up these genes. How do you look up these genes? Well, there's a lot of different reports. And at our event, I'm going to be talking about how you know whether you have these and some of the services, the pluses and the minuses of some of these services that will help you and what kind of reports you can get to be able to look at it. I know 23andMe has lost a lot of favor because back in 2018, they cut the amount of genes they look at dramatically. And some of them are really important ones to look at to help people with mood disorders and sleep and detox and all that. And then they also got bought by Bayer. And people get a little concerned about the privacy issues. So there's other things. And we have 2 different people speaking at our event in June that are masters at this. Ben Lynch, who's heard of Ben Lynch? You heard of Ben Lynch? Or if you haven't heard of Ben Lynch, you're going to hear amazing stuff from him. And then Dr. Christy Sutton, who wrote the book. This book here is one of my favorite books, and I recommend it all the time. She wrote this book. It's an amazing book. So she's going to speak at our event. And she also created a great report that you can run your 23andMe through. We'll have a whole section at our event talking about the pros and the cons of each of the different services. FODMAPs. These genes are going to predispose people to having FODMAP sensitivities. So they have to be more careful about their gut health, right? About keeping those bad organisms at bay, eating more fermented foods, et cetera, et cetera. But then you might say, oh, what if they have FODMAP sensitivity and they have histamine sensitivity and they can't eat fermented foods? We'll go through that in more detail, but there's approaches that you can make. There are some fermented foods that may trigger them temporarily. So which do we work on first, right? So there's some approaches that are beyond the scope of here because, actually, Steph Jackson's going to talk a lot about that. She has at our event, we're going to have 2 days on this coming weekend of extra 90-minute sessions that are more in-depth on specific topics. And she's going to go into a lot of depth on the microbiome and the genetics and how you can protect people from the bad effects in the outside world. So these are like FUT2 is a very common one that they cut a lot of them out from the 23andMe, but there are other ways that you can get it. Self-decode is one of them. Histamine related genes. Do people have these? And the RSIDs are the research IDs that these have come up with. And the genes are like where they're located. And I'll go through a lot of the basics of the genetics to review for those of you who already know it, but forget maybe. And those of you who don't know it are going to learn it. And those of you who already know it and didn't forget, you can just go get a cup of tea while I talk about that part. Okay, fair enough. And then here's the ones that are related to lectin sensitivity. Unlike Dr. G says on all of his videos that are out there, that he goes on and on and on and on and on, and then says, but all you have to do is take my supplements at the end. There's genetic tendencies. Some people don't have to be concerned about, maybe their handful of almonds every day causing them to have a problem, right? So we have to look at their genes to see how are they manifesting. And if they have the genes, then we have to be more careful about their exposure and keep that exposure down. And then this is just a summary. If you want, take a picture of this one because it's a summary of all of those different, like gluten-free and dairy-free, anti-yeast, antifungal, SCD, GAPS, FODMAP, low oxalate, low salicylates, low phenols, and low sulfur. They're just the names of the genes, which then you can look up to see if the person you're working with or yourself has those manifesting in their genetic reports. And I'm encouraging anybody that comes to our 3-day event to bring your genetic reports so that you can put out, or yours or a patient's or client's genetic reports. So as we're going through these sections, you will know what to look for. Okay, so now let's look at, those are the genetics. We looked at the symptoms. These are ways of assessing. Let's look at some testing. Like I said, haven't met a food intolerance test yet that I appreciate because they all give some false negatives and some false positives. And sometimes what happens is they may be having a problem with gluten that's not an immunologic. It's not one that's producing antibodies, but it might be related more to the specific carbohydrates, the FODMAPs, whatever, the lectins. And they'll get a food intolerance test that's just testing for allergies. And it says you're not allergic to gluten, and they start eating it again. And then they get worse. So you have to be really careful about the testing and what messages it's sending to your clients and your patients. I found that I did a food intolerance test years ago for myself and my husband years ago. I mean, like 25, 28 years ago, I was first starting my practice. And I looked at the results and I'm like, huh? Like he is deathly allergic to soy. Like he puts soy even near him. He breathes soy flour and he gets an immediate reaction. His lungs close up and his gut freezes up. And it said he had a mild intolerance. This was not a mild intolerance, right? So, and then I hadn't had dairy in many years when I had it taken, and it still said I was sensitive to dairy. And I'm like, okay, that's fine. But then it said I was sensitive to something that I never had before. And I'm like, yeah. So they're maybe 85% accurate, and they can be used as part of a complete workup. But you also have to look at other things. You want to look at inflammation markers. You want to look at their regular old blood chemistry and see if they have elevated CRP, homocysteine, C-reactive protein, other things like that, that there's some inflammation, because that's often an indication that there's some food intolerance going on. You're also going to look at food frequency, right? You're going to do food frequencies to see that. I showed you that earlier about doing diet diaries. And then you want to look at, how do you know if they have leaky gut? Right? You can do a GI effects, a GI map. There's tests like that. It's a very cool picture, I thought. No? Funny picture? Doesn't actually look like that, but you know what? It reflects. The gut means it's not the leaky outside. Fortunately, it's not like the gut contents are leaking out, but it's leaking into the bloodstream. The contents of the digestive tract, which are meant to be broken down into teeny tiny particles, right? Like nutrients, but the gut is leaky. The membrane is hyperpermeable, and we're getting larger proteins getting in there. And then that triggers the immune system to say, hey, there's some bad guys here, just as if it was a strep or a staph or something like that. So leaky gut can be contributing. So we want to look at the food-related genes. There's some specific food-related genes, like we talked about. And so let's look at that. And then we want to look at the nutrient-related genes. So here's the foods that when you're putting this plan together, if you're seeing that they have symptoms, like from that chart that I showed you, they have some of the genes, you're going to say, okay, let's get you on a low oxalate diet for a while. It doesn't mean a no oxalate diet, because when you put somebody from high oxalates to too low, it actually causes the body to start dumping more of it out of the tissues. And then they have more symptoms. So when you look at how much oxalate does it mean, there's all kinds of charts on the internet. There's also a program called Chronometer, and you can put all your food in there and it'll tell you how much oxalate is in the food. So we're thinking like a high oxalate diet is 250 or more. A low oxalate diet is 50 or less. So you're looking at, if somebody's on that really high end, that you slowly reduce them down to the point where their symptoms start to dissipate. Does this make sense? So these are some of the foods. A lot of nuts, especially almonds and peanuts, some of the seeds as well, most of the beans, beets, figs, rhubarb, Swiss chard, field greens and spinach, buckwheat, chocolate, unfortunately, tea, blackberries, raspberries, gooseberries, amaranth, soy, sweet potato, citrus peel, and kiwi and star fruit. So if somebody tells you, I was doing really well when I was eating like mostly meat and iceberg lettuce salads, I read about how I had to eat more greens and more nuts and seeds and all this, and then I got worse, they may have an oxalate sensitivity. And they had a history of kidney stones or vulvodynia or all those symptoms we talked about. Here's some of the high salicylate foods. And the salicylates got famous with the Feingold diet for ADHD years ago. So if you have somebody who's showing some of the symptoms of salicylate problems and they have some of the genes, here's some of the foods they're going to have to reduce, not avoid completely necessarily. Unlike an allergy, if they show up where they're having an immunologic response, it could be very, it's not just in large amounts. With this, it's like more reducing the total amount of these food constituents. Berries, apples, grapes, tomato, almonds, honey, avocados, spinach, cantaloupe, watermelon, and dates. Then we have amines, and histamines are a type of amine, but there's other types as well. You're going to see some overlap between these, right? So you look at these, soy sauce, natto, wine and beer, chocolate, bone broth, hydrolyzed protein. A lot of people are going on these bone broth kicks because they want to build good collagen, but then they feel worse because they have amine sensitivities. And then there's histamine. And I find that people who have histamine intolerance will find that after they eat certain foods that are high in histamine or a meal that has a lot of histamine type foods, their belly gets red, their nose gets red, their throat gets scratchy. So strawberries, kiwis, pineapples, bananas, walnuts, hazelnuts, wine and beer, soy milk, vinegars, spinach, eggplant, lentils, and seafood. And then you have your lectin containing foods, right? There's all kinds, and it's categorized here: nuts and seeds, fruits and veggies, legumes, grains, all animal foods and sweeteners, right? So you look at that, low lectin, high lectin, lower lectin, everything has them, right? It's just lower versus higher. Okay. Voila, I love charts. I love charts. I love making charts. I love putting things together that seem complex, and there's just a lot, and I like putting them together in charts. So this chart is similar to the first one I showed you, where it has all the food religions across the top, but then it has the lists of the foods down on the left-hand side. These are in alphabetical order, so you generally can find it. The green means it's low FODMAP, like here. Alfalfa seeds are good for a low FODMAP diet, not for a low SCD, and not for phenols or salicylates, right? So if you determine that this person has a sensitivity to whichever ones are up here, you just go down and you reduce or eliminate the foods that are red. The yellow, you proceed with caution, and the green are fair game. The white one is we looked and we looked and we looked and we looked and we looked, and we couldn't find anything that had a clear delineation of bean sprouts, whether they have high or low in oxalates. So if you happen to have somebody you're working with who has a very severe oxalate sensitivity, I kind of avoid the ones we don't know about, and then maybe a little bit here and there to test. This chart looked good. We'll be giving this chart out at our event in a week, a little over a week and a half. All right, so we talked about the importance of the thorough assessment. We talked about the kinds of assessments. We talked about genetics, history, cultural considerations. That's something in a coaching relationship. You're not going to say to somebody who says, I absolutely hate coffee, oh, coffee is a really good food for you. If you were to say that to me, I don't care how good it is, I'm not drinking it. It's disgusting to me. Every time I put it in my mouth, I've spit it out. So you'd have to really make a case that it's going to save my life in order for me to drink coffee. And there may be foods like that. Like, I'm okay with Brussels sprouts. They're not my favorite, but I'll eat them because I know how healthy they are. But there's other things that is like, I think really that, and kasha. Who's ever had kasha? It's a roasted buckwheat, and they toast it, and then you cook it up like rice. And every time my husband has made it, I walk in the house and I smell it, and it makes me gag. I've tried to eat it. Yet I can eat raw buckwheat, like if it's buckwheat made into like buckwheat sprouts. So I have that. Those two foods are the only two that I can really think of that I chose. Oh, what's that other one? It's a big fruit. I forget what it's called. It's big and it's ugly looking, but everybody raves about it. And I can't stand it. It just like, it tastes like soap. So people have preferences, right? For whatever reason, they have preferences. So now we're going to look at nutrient deficiencies, because when you're looking at putting together a personalized program for somebody, you want to avoid the things that they're sensitive to. You want to enhance their ability to absorb. And you want to fix their nutrient deficiencies, right? So how do you determine what those deficiencies are? Again, I go to these forms because there are a lot of good tests for nutrient balance. They tend to be quite expensive. Just testing a nutrient in the bloodstream, other than D and A and K, no, K can't be done that way. D and A, magnesium, you need to look at the red blood cells. There's different compartments that have been found that you have to look at. If you look at the magnesium in the blood and it looks fine, it's really not a good indication that the person is good or bad in magnesium. Whereas if you look at the D, it tends to be. So I like to look at, do people have symptoms? So I have a page for each of these. This is essential fatty acids. I have one for each of the vitamins. I have one for each of the minerals. And you can get a score as to how likely this person is to be deficient in this. And when you do this, and then 6 weeks later, you do it again, they don't have to pay anything. You know what I mean? They don't have to pay another $400 to get these things tested. So that's what I like to use, but there are also some tests. I'll show you some of those as well. Then I have this scorecard page, which lists all the different ones that I have assessments for. And then you can keep a score, right? So I like to put down what's the max score, what's their score, and then what's the percentage, right? The higher percentage is worst. Unlike in school where you want to get 100%, here 100% means you have 100% of those symptoms. Not a good thing. So that's that. There's also nutrient-related genes. So you may find that this person is eating a diet that's loaded with magnesium, and they even take a magnesium supplement, but they always seem to have symptoms of low magnesium. They may have a gene that's related to them not absorbing their magnesium real well. So you're welcome to take a picture of this. We have some really cool charts that we're going to share at the event with that you can see all of these different ones. And this book has a lot of them in it. This book is really nice for that, and it describes it. This is the Genetic Testing, Defining Your Path to a Personalized Health Plan, Christy Sutton, and she's going to be speaking at our event next week. When is she speaking? I think on Sunday. I put together these really cool charts that have vitamin and mineral SNPs, single nucleotide polymorphisms. If you haven't done much with genetic testing, they're what people used to call mutations. You're not mutated, you're just different. You have a variant. So we have those couple of pages of that. And then labs, right? I try not to have to do too many labs because they cost. And if in order to see if there's a change, you're not going to do it every week or 2 or 3 or 4, right? It's usually 3 or 4 months. So let's look at what those labs might be. But then using those forms in between is super helpful. So what's some kind of functional lab testing? There's the adrenals, cortisol lab, saliva testing. There's the Dutch test, which goes on urine. There's the comprehensive digestive analyses. We have Genova has GI effects, and we have diagnostics, something clinical diagnostics has GI, what do they call it? So it's GI effects and GI map. So there's different ones. Doctors Data has one. So different companies, whatever one you like. We order a lot of them through Rupa Health. Immune system evaluation, fatty acids, amino acids, organic acids, heavy metals, methylation, and genetics. And Lisa, who's one of our health coaches, she had over 20 years of experience as a health coach, nutritionist, not just a health coach, but a nutritionist. And she's really, really good with the lab testing. And she's going to be doing one over this weekend, talking about a lot of the lab testing. There's a bunch of them. There's serum tests, which I said, not that great for nutrient evaluation. For some of them, it is. Red blood cells, like magnesium, is really good in the red blood cells. White blood cells. SpectraCell does white blood cells. NutriVal or metabolomics, that's a lab from Genova Diagnostics. And it looks at not just how much of this nutrient is in the system, in the red blood cells, the white blood cells, or the serum. It looks at the functional pathways that rely on that. So we're getting a functional assessment of B12, say, for example. A lot of people will run B12 in the serum. It's not very useful, not very useful at all. Except if it's really high, it often means it's really low in the tissues most of the time. If it's really low in the serum, it most likely is low. But when it's in between and when it's high, we really don't know, but we run a functional test called methylmalonic acid, right? We also can look at homocysteine and MCV. We'll go through more details about some of this stuff at our upcoming event, but knowing that you can't just rely on the serum levels is super important. Then we have organic acids, which are intermediate acids that get produced in the system when we have low or high levels of certain nutrients. So these are all what you need to learn to do a comprehensive assessment. So I'm going to show you just some scenes from the lab tests. These tests each would take hours to do. I pulled some of these slides from our nutritional endocrinology practitioner training. So each of these comes from an hour or 2 of education. But here's stool testing, right? This is from the GI effects test. And it gives you a nice indication right up front. This is actually a very well-balanced person, but it gives you a score from 0 to 10. And then there's all these other markers that are deep inside the test, which I'll show you a few of them, that gives somebody an indication. Does anybody think they would like to have a good tutorial on how to read these tests? Yes. Yeah, we have access. We have a way for you to access that. Right. So this person is actually not bad, right? She's just got a couple of 2s and the rest are 1s or 0s. It could be 9 or 10. And I've seen people with 9s and 10s here. And it means it's a high priority to get these things balanced. So then this is the organic acid test from, is this the Great Plains? Yeah, this is the one from Great Plains. You can just order organic acids and it will give you page and page after page. And you can look at the pathways and determine who's in balance and where they're out of balance. Are their mitochondria out of balance? Are there neurotransmitters potentially out of balance? So that's that. Another one here, I'm going to go show you a few of the pages from this metabolomics and NutriVal. NutriVal and metabolomics are pretty similar, except that the NutriVal requires a blood draw, a venous blood draw. So you have to go to a doctor or a phlebotomist or a lab and have your blood drawn to get it. The metabolomics does it on a blood spot done from home and sent in, plus urine that you can do within the within the privacy of their own home. So people who have a problem with having a doctor that's willing to draw their blood to run some of these what do they call them, edgy kind of tests, right? They're not typical medical tests. You may have that work better. So in there, the core test includes organic acids in the urine, amino acids in the urine, and oxidative stress markers. The add-ons on the metabolomics that make it look like the NutriVal are the elemental markers, so heavy metals, and the essential and metabolic fatty acid markers. And then that's done on the red blood cells, but it's done from a blood spot versus a venous. And on the NutriVal, the amino acids are done in the blood. So there might be slight differences there. And then there's a potential to get some genomics. I've never run it because most of the people I work with, we have them do genomics through other places because this is a pretty limited genomics test, just saying. So this is what that metabolomics or NutriVal will look like. So this is the metabolomics. Again, I love that it gives you a score from 0 to 10. This person's in kind of trouble in some of these areas, right? They need inflammation support. They have reduced exposures that they're being toxic exposures. They need methylation support. They're good on the mitochondrial function, and they're kind of in the middle for oxidative damage. So you get an overview of where things are out of balance, and you can match this up with some of the genetics. So people say, well, you can't just look at their genetics and give them a supplement plan. There are companies who will say that they can do that. Dr. Ben Lynch, who's going to be speaking at our event, I interviewed him and he's like, I could make a fortune if I did that. I have the lab, I have the genetics test, I have the supplement company. He says it doesn't work that way. I teach people to use just what they need to make sure, and only use them when they need them, not to take supplements every day for the rest of your life. I trust the guy because he's being honest, right? His pocketbook could be lined with gold if he did what a lot of these companies are doing, because he has a reputation for being super smart, which he is. And the NutriVal, very similar. You know, it's the same categories and they give you a score. Deep in the bowels of it, there's a page that gives you an idea of, are you green, yellow, or red on the various nutrients? There's another page in there that's looking at the organic acids. This categorizes it a little bit differently, but it still categorizes it similar to the Great Plains test. But this is incorporated within the NutriVal or the metabolomics. They have malabsorption and dysbiosis and yeast and fungal markers. This isn't measuring their stool. This is measuring metabolic products that are produced by these organisms. And if you do this and you do a stool test, you're going to see this person has a whole lot of imbalances going on. And if you look at their genes and they have FUT2 and some of the other markers for gut dysbiosis, then you know that we really need to address this because they're genetically prone and they're showing signs of these overgrowths and imbalances. So we need to address it, right? Does this make sense? Yes? No? Am I going too fast? Tasha didn't put up the slow down sign yet. Yeah, I'm okay.
And just a quick reminder to everybody, if you've already signed up for the event, or if you do sign up for the event, these slides are on your event dashboard.
Oh, yeah.
Well, I just posted them along with the replay. I already have it up. Not the replay.
The replay not.
This is still going on, but these slides, as well as the last two webinars, you'll be able to find on your dashboard until the event starts.
Well, then
so
they go
you
down?
can take screenshots. I mean, we could always extend it, but that's just how I have it for right now.
Okay, cool. So if you're liking my slides, and people always ask me for copies of them, I'm going to bribe you to come to the event and do it. If you're already signed up, you'll magically see this there when you log in, and the replay will be there probably by tomorrow morning. Okay. Depends on whether Andy's working tonight or not to pull it down and edit it and put it back up again. All right. So then you have these other kinds of organic acids related to mitochondrial function, neurotransmitters, and detox. And guess what? When we look at the reports from the genes, we have these kinds of sections. We have genes related to neurotransmitters, genes related to detox, genes related to mitochondria. So you can actually verify if this person is having some real issues or if the genes are there, but they haven't been activated right now. And that helps. It's almost leverage that you can use with people to help them to make decisions about changing things, right? In order to be healthier. And Christina, you're there, you're in OBGYN, right? And you work with people who are carrying babies and they want the best for their baby. And when you can use some of this as leverage, like you eat this stuff during your pregnancy, you can really affect your fetus. And, you know, you're going to affect yourself as well, because you're not going to be as good a mama as you can be. Like there's so many ways that we can use this to leverage people to actually make the changes, because it's hard. Somebody's grown up eating Cap'n Crunch and M&Ms and all this stuff, and we're trying to tell them to stop it. Somebody said to me, or somebody said, I think it was earlier today, I heard somebody say, when you speak to people during like an intake and they're trying to decide if they're going to work with you, one of the things to say is, look, in order for me to know whether I'm going to be a good fit for you, I need to know the answer to this question. Does anybody want to know the question? Yes? 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 Screening out people who are going to be good fits? Who wants to know the answer? What's the question? You say, so we're going to work on lifestyle and diet and changes. Are you willing to stop doing the things that are leading to the symptoms that you're currently having? Say no to that, right? If I say, are you willing to give up sugar and gluten? They'll go, well, I don't know. But if you word it, are you willing to give up doing the things that are causing the symptoms that you're coming to me to help you with? If they say no, my answer to them would be, it's been a pleasure to meet you. I'm not the right practitioner for you. Because I don't have a magic wand. I do have a magic wand, but it doesn't really work. It doesn't work. You got to do the work. Your health is not going to come from a bottle, a potion, a powder, a particular thing that you can buy. It comes from doing the right things to restore balance to what's really causing the symptoms that you're experiencing. Is that helpful? And at our recent NEPT is our nutritional practitioner training. I see a bunch of you here that are in it. We had our retreat last week. One of our members who came is also an OBGYN, and she's been delivering babies for 20 years. She's delivered 10,000 babies. You probably have delivered a lot of them too. I don't know how many, Christina, but she basically said right away when somebody says to her, but I don't like it, it doesn't taste good. She said, you know what? It doesn't matter how it tastes. It matters how it affects your body. Doesn't matter how it tastes. It matters how it affects your body. Of course, we can help people make foods that taste great that also help their body. But the stuff they're buying at the supermarket, guys, it ain't cutting it. It's not doing it. The M&Ms, I grew up on M&Ms. I grew up on Kool-Aid. I grew up on Ronzoni macaroni that we melted Velveeta on top of. It didn't contribute to me being healthy. And my health fell apart in my mid-20s as a result of that. And I'm not willing to go back there. So we talk to people about how willing are they to make changes that are going to rebalance them and get rid of the symptoms that they're complaining about. Is this making sense? Yes? No? Anybody willing to say those things to people? Who's willing to say those things to people? Raise your hand if so. Yes. Yes. Awesome. Thank you. Okay. So this is the metabolomics. We'll have a lot more detail about it at our event. Because literally in any PT, those of you who've gotten that far along in the curriculum, I think Rachel, you're not quite there yet because you just joined a week ago. So don't feel bad. It's module 20 something, like 22. So it'll be a while before you get there. But there's a whole bunch of, modules going through these tests and examples, and there's case studies. So we take people through that on a step-by-step basis. Oh, it's thundering out. Interesting. Fatty acids. Fatty acids are so important because inflammation is one of the most important contributing factors to disease these days. Everything from brain stuff to peripheral neuropathy to injuries that won't heal. Fatty acids are involved in the inflammatory pathways. And so when you can look to see, does this person more skewed towards inflammation or not inflammation? And you'll learn how to read these when you're in our program. This is the metabolism. And see, in this particular case, this person's very low in the omega, let's see, she's very high in the omega-6 linolenic acid, right? And so it's like, oh, some of these downstream metabolites are also low as a result. So she's not going to be able to be doing much in the way of anti-inflammation. So that's a lot, right? I don't expect you to get that and be advanced at being able to read these. Some of you already read these and it's great. Some of you have not done it yet. That's fine. We can help you with that. But what's the action plan? What do you do when people have symptoms and you have that chart? We're going to give you that chart, and they're eating certain foods that are aggravating their symptoms, and they have genes that are predisposing them. So what I like to do in order is I like to look at and note any genetic tendencies they have that could be related to their SNPs. I like to do it with, you're not going to look at every single one of them because that would be a 14-hour preparation and then, a 5-hour, 10-hour session with them. And nobody's going to pay you for that. Nobody, you know what I'm saying? Nobody's going to pay you for that. So you're going to go through, do a history and note what specific genetic SNPs might be related to the symptoms they're having. Evaluate for symptoms of specific nutrient imbalances. If indicated, perform lab tests. A lot of times you can get started with just the blood chemistry that the doctors run every year on people, and start with a lot of information from there if you know how to read that from a functional perspective. You educate them about food sources and interfering factors, and you educate them about some of the genes that are related to certain foods and symptoms, and they have to maybe reduce. You recommend foods to avoid and foods and herbs to increase, and then if needed, supplement. Notice supplement isn't right at the top. Oh, you have this and this and this. Here's your 15 supplements. Take them for 3 months, come back and we'll see where you're at. That's what a lot of practitioners are doing, but that's really a medical model still. It's an allopathic this for that model. We're moving away from that model, pulling all this data together and coming up with a way to help people to feel better. Is this making sense? Is this like too much? Am I going into too much detail, or is this good? Anybody want to say? Is anybody saying in the chat? Anything in the chat? It's okay. So what do? I ask them to track their usual diet for 5 days. If they won't do 5, I barter with them and say, okay, how about 3? Do it for 3 days. And in a software called like Chronometer, there's others like that they can track it in. And then we look at the nutrients that scored high on the symptom surveys. And we look in this software and the tracking to see, are they eating enough of this? Are they low because they're just not eating the foods that contain it? Or are they low because their body's not absorbing it from the foods they are eating? And then we determine the foods to add and make it up and we supplement. Right? That's what we do for the nutrient imbalances. If they tend to have certain of the SNPs, like zinc is a really hard one. And if they have a genetic tendency and mama was deficient in zinc when she was pregnant with them, the likelihood of them repairing that zinc deficiency without really focusing on it is slim to none, right? So we have to look at it as a full perspective, right? It's not just the nutrition. It's not just the genes. It's not just lab testing. It's the composite of all of that. It varies from who you read and what studies you read, but generally speaking, the diet, lifestyle, and toxic exposures are going to contribute to 85% of a person's health picture. 85%, that's high, right? And then the other things, the genetics are only usually about 5%. Some authors or researchers will say more. What's his name? Oh my goodness gracious. I was just going to, Bruce Lipton. Who's heard of Bruce Lipton? He was a geneticist who then went into doing a lot of studying on this and said, you know what, really? The genes make up less than 1%. It's really the diet, the lifestyle, and the thought processes. This is an MD, PhD researcher who's saying it's the food and the thought processes that contribute most of it, not the genes. But knowing the genes is super helpful for helping people to make the changes because they know, whoops. It's a full picture, right? It's all the right things, the exercise, the stress management, having fun, eating good food. So the medical model, like we said, is broken. They look at symptoms and they say, here's your symptoms. Let's give you something to get rid of the symptoms. So let's give you some anti-inflammatories. Let's give you some antacids. Let's give you something that's going to hit the symptoms. But generally speaking, that doesn't work long term. It may not even work short term because they haven't addressed the problem that's below it. So if you're getting gas and bloating after a meal and you take an anti-gas drug, your gas is going to go away, but the problem is still there. Even if it's an herb, like you take fennel to get rid of the gas and bloating, it might get rid of it, but it's not getting rid of the problem. And you keep getting it and you have to keep taking the drug. But even just addressing the problem, like IBS, okay, that's a diagnosis. That's a problem. But what's causing that IBS? What's under it? Is it nutrient imbalances? Is it bad organisms, right? Microbiome out of balance? Is it stress? Cortisol levels being too. Our job is to help people get to the cause, make the changes that they need to make to actually facilitate the problem going away so the symptoms go away. Does that make sense? We're not treating it from up here down. We're treating it from here up. And it's not really treating it. It's creating imbalance, balance where there's imbalance. So I like to look at the body as this integrated whole. And a lot of times in a medical practice and even a functional medicine practice, somebody will come in with symptoms of thyroid problems, right? And they go, oh, look, your TSH is high, your T4 is low, here's some thyroid medication. But they're not addressing what caused that thyroid imbalance. So I look at all of these pillars as holding the whole system up. If they're not having fun and they're not sleeping and resting and they're not moving their body and they're not in a clean environment, they're in a toxic environment, the diet isn't helpful. The outlook, like their negativity, who knows, negative Nellies, right? Versus positive Polly. So, and then the mindfulness. And all of those things can be shifted. Talking about outlook. My son, I find out this morning, his truck got stolen overnight. It just in the parking lot outside of his apartment building, his car got stolen. And I called him. I said, I'm so sorry. I said, how you doing? He goes, what can I do? I just have to move on, right? That was an attitude. He wasn't like, he didn't get into that. Because, Mom, I said, nothing I can do about it. I'm going to call the police. We're going to get a report. We're going to file it with the insurance. Hopefully we'll find it. He goes, the brakes were no good. Poor bad luck on them. I was going to bring it in today to get the brakes fixed. Okay, so here's the thing. His attitude, his outlook about it was positive. He wasn't letting it go in and create a cortisol surge and get him all bent out of shape and get his health at risk. I mean, it's easier said than done, I know. But a lot of people, I talk reproductive hormones, basically people in, kind of our age group mostly, most of the people on here I see are in, the women, 40 and up, 35 and up, that you go into the doctor and you're complaining about hot flashes. It has to do with your age. It has to do with your going through menopause. But hot flashes aren't related to menopause per se, or the fact that you're 50 years old or 48 years old. It has to do with the imbalances that have been there that don't allow the natural flow into menopause. I never had a hot flash. I know many people who have taken care of themselves up until that point who never had a hot flash. It's not normal. In other cultures where they're not as westernized and crazed as we are, They don't even have a name for menopause. It's just the elders, right? The elders who don't reproduce and the youngers who do. That's it. So we have to look at the whole picture. And that's why we created our event, because we want to help you to really personalize herb supplement and diet recommendations, learn to motivate, inspire, and empower them to take action. So the clinical functional nutrigenomics and clinical practice starts next Friday, June 2nd to 4th. And guess what? You don't have to travel. The event we did last fall, we did it in person. This is just online. You can come and attend our event online, 3 days of amazing content, me and all my guest speakers. And we're going to teach you a lot of stuff. We're going to teach you, what do these things called SNPs really mean? And what does it really mean in terms of what these people are going to experience? We're going to teach you about functional lab testing, right? I gave you an overview here. We're going to go into more depth. We're going to teach you how to use the nutrigenomics and functional lab testing to create effective and profitable programs. I actually have 2 people talking about how to take what you're learning and create a program that you can offer, whether it's a one-to-one package that you offer somebody that you're going to take them through program, or a group program. Eventually, if you've done a lot of one-on-ones, you can move into groups so you can leverage your time, make a profitable and a thriving practice so that you're not like just having fun with this and not doing anything. And that's a really important thing. How do you take what you learned, right? And what do you do afterwards to support clients and maintain your own balance? Because guess what? We probably all have some things we could be working on. So you can be working on yourself. You can bring your own labs. You can bring your clients' labs, and we're going to take you and help you to put action plans in place based on the test results and the genetics. So what's included? 3 days of online trainings. We're going to give you a workbook with handouts, worksheets, and checklists. So you saw my worksheets for the SNPs. We're going to give you those. We're going to have some networking sessions, breakout sessions where you can meet other people. And let me tell you, we have people who have made best buddies just by coming to these events, and now are, working together, enjoying each other, and helping each other to grow their practices. Coaching opportunities. We have a whole thing on Saturday night where I'm going to take people, you get to submit your form and tell me about what you want to work on, and I'll help you with that, with your, a client related thing. And then you can access from anywhere. So you don't have to leave. Diana, you're in England. The timings might be a little bit off because, we're trying to affect all different time zones. So you may have to stay up a little later, get off on your schedule for a little bit, but you don't have to travel. You don't have to get on a plane. So if you go to nesliveconference.com, NES stands for Nutritional Endocrinology Symposium, liveconference.com, you'll get all the information. The total value of 3 days of everything you're going to get with all that education, plus all of the handouts and stuff, $19.97. I was just talking to a business coach today who just recently spoke at an event. And he said that they charged $3,000 per ticket. It was a 3-day event. Like, okay, so I'm not far off in $19.97, but I want to have it be so more people can come. So we decided to make the investment in this program $297. So if you decide you're going to come and you come to the door on Friday, it's $297 for you to join. But because you're here, because you spent time with me today, we're going to just drop that to, where'd it go? Okay, this slide screwed up. Anyway, it's just $97. We decided to keep the early bird investment, even though we're a week away from it. We just decided to keep it that way because we want people to come. We want you to get this valuable information. My mission is to change this broken system. And the more practitioners that I can train that can come and, take advantage of my 30 plus years of experience and get this out to the community, the better. So share this with other practitioners, share it with some of the ones that may be a little skeptical and want to know more about some of the nutritional things and don't know it. Share it with people who are, like you, into this stuff. So $97 is all when you get to the page, you're going to see it looks like this. You'll fill it out. You'll put your credit card in. If you want to add on for, what is this, $25, you can add on a workshop I did called The Genetics of Blood Sugar Balancing, which is like a 90-minute presentation and all my slides and everything related to blood sugar balances. Some of you may already have that. If you're in IRSPT, you probably already have that. If you're in any PT, you already have that, so don't add it on. So recap everything: 3 days of live events, the networking session, access from anywhere, coaching, and the conference workbook. Those workbooks alone are worth more than the price of admission because of the valuable packed information that's in there that you can use right away. Once you sign up, $97. If you decide that you want to do more, you want to do the extra trainings that we're doing in advance, these are the 3 that we're doing that are trainings, and then there's a get to know you reception with me. You can just upgrade to the VIP version of it. So you'll get all of that, all of those pre-trainings. You'll get a training afterwards, and post webinar, put it all into action with me. It's usually those run 90 minutes to 2 hours. So we can take everything and you can go, okay, I'm a little bit, my head is spinning. What do I do now to put this into action? And then you get all the recordings. That's the cool part. So if you are in England or Switzerland or someplace where you have to stay up till midnight or later and you don't want to, you can watch as long as you can, and then you can get the recordings. And the recordings are usually up within about 4 to 6 weeks, probably sooner than that, but we don't promise that they're up sooner than that. Tasha would be able to tell us better. But you'll get video and audio, so you can load it up onto your phone and listen to it while you're running any of the sessions that you really want to do. You can listen to them again and again. You'll get all of the PDFs of the slide presentations, so you can take notes on while you're listening to them, and any of the ones that are done during the extra bonuses. And if you've ever had Steph's slides and Lisa's slides, they're usually packed with great information. And there's extras for the VIP, some extra checklists and genetic interpretations and assessments. And we set these up so you can just hit the ground running, Monday, Tuesday, whenever you're back in your office, and you can use them with your clients. So it'll save you like dozens and dozens and dozens of hours in creating them yourself. I've been doing this for over 30 years. And when people look at the amount of stuff that I've put together, they're like, how did you do that? Did you ever sleep? Yeah, I did, but it was 30 years, And then there's some extra handouts like that because you're going to save time and money. And and the VIP all access passing summary is the extra bonus sessions, all the recordings, the PDFs and all the slides, and all the extra stuff, and the reception with me. So in addition, so if you haven't already gone there and signed up, you're going to get some extra stuff when you sign up now. A quick action bonus, and these are in place, I think, until the end of the week. Genetic interpretation worksheets that are phenomenal. These took me dozens of hours to create, and I created them out of necessity when I was working with people. Why is that there? These slides, what happened? I fixed all that. I don't know what happened. Anyway, there's this one that you can list all the people's stuff, and it'll have a note. If they have a particular one of these, it describes what it is, and you can just highlight it. Like you can take these and make a document for each person and say, oh, they have this FADS. Okay, what does that mean? And what can I do about it? Right. So you can do that. And then you have this summary template that you can make notes on. Wow, that's so weird. And then this one's one of my favorites, genetic and lab nutrient needs worksheet. So based on, I have a list of all the nutrients off to the left, and based on what you're finding, either on the form they filled out or their genetics, their blood chem, their stool test, their Dutch test, why is it that I'm thinking they need this kind of supplementation or food or nutrient? And you can either get it from supplementation or food. And then diet recommendations based on the SNPs in the labs. So foods, if they have specific SNPs, they're going to need to avoid specific foods or minimize. That's what I've listed. If they have specific other SNPs, they're going to need foods that they need to emphasize. Is this every SNP you could possibly find? No, but it's the ones that I most commonly found, right? So use the advantage of my clinical experience with thousands of people to be able to get this. So nestlifeconference.com, I'm looking around. I know a bunch of you are already signed up. Great. And if you're not, now's the time because we really want to do that. That's just bonus number one. Behind the curtain of bonus number two is this really cool presentation that Steph did for us at a Shine. I don't know if it was last year or the year before, but it was phenomenal. Fermented foods and personalizing microbiome using genetics and lab testing. It's like a 90-minute presentation with these absolutely gorgeous slides that you're going to get. And then ultra quick action bonus. This is for people who just take quick action and you sign up today. If you've already signed up, you get the quick action bonus for today, right? We don't penalize you for signing up early. We penalize you for signing up later. But we threw this one in because this is autoimmunity is rampant these days. There's a lot of genetic factors. There's a lot of lab stuff. And if you can master the 5-part framework for reversing autoimmunity, you're going to be in great shape. It's a handbook that I put together from a previous Shine that goes step by step through how do you work people through when they have autoimmune disease. 85 pages. Woohoo. And then, just reviewing the bonuses, all those bonuses I just mentioned are $1,300, $3,200 bonus. And again, it's only $97 now, right? So sign up, get in, upgrade to the VIP to get even more. And we'll see you next week, a week and a half on the 2nd of June. I'm super excited. I'm super excited too, because we're doing it. Usually we do these at my house. We like tear apart my living room and we create this studio. And we're actually going to somebody who created a studio in their whole second floor with all the screens. He calls it the Tony Robbins type studio. So I'll be able to see every single one of you out there because he has like 6 TV monitors in front of me so I can see it, and it's going to be amazing. And I can't wait to do it. I'm really, really excited. So now that you made it to the end, I should have made this a pretty link, but
I already found it because I found your slides earlier. Let me grab the link.
Okay, good.
Because I didn't like that link.
I didn't like that link either.
I didn't like that link at all. Okay. I just posted it here in the chat. So it is the same document, but it's a nicer link.
It's an easier link to go to. And basically it's going to say to you, make a copy. Because I don't want you editing my form. We've made that mistake in the past a couple of times where we didn't do that. And somebody's like, give me permission to edit your form. And somebody might have accidentally done it. And then my form got messed up, right? So you make a copy on your own sheet. You can make as many copies of this as you want. You can make one for yourself, for your family members, and for all your clients, right? And you just keep making copies of it. And you can actually write on it, and you can circle the ones that they have, right? The symptoms they have, and you can use this and keep this in your files for people. So this is phenomenal. What is the thing? I can say it out loud for those who.
It is drreademery.com/food religion symptom grid.
Oh, it's still long, but okay.
It's still long, but it's not what you have up on.
Not all that stuff. Right? Food religion symptom grid. Okay. And yeah, enjoy that. You'll also put this on, will you put this on the for people who join? You'll put it on the
Yep.
Yeah, she'll put it with the replay and the slides for this. So when you join, you'll get this right away. Okay. So there you go. $97, right? For a 3-day event, $97. That's $33 a day, less than $33 a day for all this phenomenal information. Just hearing any one of the presentations is going to make your day. And learning how to walk away and create your own program to sell to clients and to support clients from this is going to be totally phenomenal. And that's the story. What do they say? That's all, folks. So, how are we doing? Did I blow you all away? I tried to talk slowly. I really tried to talk slowly. I didn't. Yvonne saying, no, you didn't. You'll have the recording to listen to again. It does slow me down when we do the 3-day event because we have, other people I have to go. D to everyone, life-changing information, truly phenomenal. Can't wait for the event. Can't wait for you to be there. So of all of you that are here that I can see, not everybody's got their camera on, but who has already signed up? Raise your hand. Yay. All right. Deb, you're not signed up yet. Celisa T, Karen, excited. I'm so excited for it too. 3 participants. Okay, so people put them in, Janet and Laurel and Cecily, and great. I'm really glad that you're going to be there. I'm really happy and excited. And those of you who are in NEPT, our nutritional endocrinology practitioner training, you should have gotten a link that gives you a bonus ticket because you're our inner circle of people. So if you haven't already signed up or you haven't seen that, just in the chat, just put a note there, and Christina, who's on the call, will email you privately that link. Even though you were able to follow it. When you listen over and over and you come to these over and over, you get, yeah. Alfredi, are you coming? We're going to see you there? Yes? Yeah. Yeah. Okay. So, chat, there's a bunch of them. I love it. Signed up, Jacqueline. Yes, I'm glad. I can't wait to do it because personally, I like longer events because I can really get into it and we have more time for questions and we have more time for practical clinical experience. Like I said, we just finished our 3-day, we have it every year, practitioner event for NEPT students. And for the last 3 years, 20, 21, 22, we had it in online like this. And yeah, it was good. It was really good, but it wasn't the same as being there. Right, Rob? You were there. Who else was there? I saw Trish here a little while ago. Trish was there. There she is. It was just so amazing to be together in person. And this event is going to be more like being in person than me standing here in front of my computer screen because I'm going to be able to see everybody. And we're really encouraging you to put your cameras on as much as possible so that I can make connections and get to know you. And it won't be so tiny. I'll get to see you all and just really support you and help you along the way, regardless of where you are, whether you're just beginning or whether you're advanced. Like I said, we had one MD that came to our 4-day actually event from England. She flew all the way in from England. She's been an MD in the British system for 20 plus years. She came in, and then another MD who's an OBGYN, been doing this for over 20 years and wants to transition to an online business. She came, and it was just lovely, right? To be together with these people who are passionate about changing the system and helping people truly get well. So who here, you can put it in the chat or you can just wave at me, is truly passionate about helping people to get well? It's just like, don't matter. Yes, I see all your Evelise, I want to give a congratulations and a shout out to you too. She passed her certification and finished that last week. But you have to get on the calendar for me. Oh no, you didn't do it. You have to finish some of your orals, right? And then you'll be on there. She finished one of her presentations last week and she did a great job. So we'll be seeing you soon and seeing it. So if you have questions, I have my hand up. How did that happen?
It recognizes when you wave your hands around. So just so you guys know,
fun.
If you have any questions, I just put the email here in the chat, which is helpdesk@drritamarie.com. So you can send anything directly to there and we will get back to you. Also, while you're on the sales page, if you notice, let me just share my screen because I also want to show you guys who ask about VIP. Well, this one is still loading. But for those of you that have already signed up for the event, and you don't already have VIP and you want to upgrade. So some of this is still hidden and you can't see all of this, but here on your dashboard, which is where you're getting, your emails are all bringing you to your event dashboard here.
9 days.
I know, We're not thinking about that yet. You can see here if you have a VIP ticket or a general ticket. So you can clearly see that from your dashboard. I already have this up for you guys, which has today's slides and that end of webinar bonus with the prettier link. And here, if you are not already VIP, you will see this option to upgrade to VIP now. If you are VIP, it shows you VIP and you won't see that button. So everything you can see from here. And then once this updates itself, you'll be able to see some extra goodies. Like you'll notice that if you're VIP, you'll see this post that has all of our speakers and event titles, and that will be updated with all of their slides. If not, you'll see this one that has the same, but I won't be putting the slides up there. And I did see a question in the chat about the speakers, and we do have our speakers built out here. So you will be able to find more information about all of them. And did you notice how I just received 10 points for navigating here? We will be giving prizes. And part of that is interacting through your dashboard here by clicking links, by participating. I'll have some trivia questions up throughout the event. I'll have other things. So just by being involved, even here on the dashboard, you'll get points for some cool things. So
Cool.
again,
Great
the
job.
upgrade button will be right here if this says general. If it says VIP, then you're not going to see that button because you're already VIP. And here on your page, oh, I thought it was on here. Maybe we don't have Zopum on here.
We should.
But any questions that you have, just send an email to helpdesk@drritamarie.com and Christina will get back to you today or tomorrow. She's really quick.
Yeah. Great. And if you have any questions, we need to put that chat feature on that page. So if anybody has a question, but usually you just go there, it'll explain everything, all the speakers, all the sponsors. We usually do raffles because we get great gifts from the sponsors, and it's gonna be a great event. So I welcome you to join us. All right. If there's no other questions while we're here, I will let you go, and we'll look forward to seeing you in, what was it, 9 days, 8 hours or something ridiculous like that?
Yeah.
Thank you. Thank you. You're welcome, Genevieve and Bonnie, and all the thank yous. I love it. Thank you so much. All right. We'll look forward to seeing you. Oh, here's the other thing I want to say. Once you join, you'll be getting an email that says, please fill out this questionnaire. It's more like a survey. So it helps you to identify where your areas of strength are and where your areas of weakness. It helps us to see if there's, a trend in that of where we can fortify the curriculum to make sure that we're covering those areas that you need the most help. So once you fill that out, you'll be able to we'll also send you a message. I think there's a message if you fill it out in a certain way, in a certain time period or whatever, I don't remember, you'll get invited to talk to one of our coaches about, how to apply this to what you're doing right now. Okay. We good? All right. You got to open somebody's line because other than Tasha, I haven't heard anybody. I need social connection. I need to hear from people. So who wants to open up their line?
Yes, we are over time though. So
okay. One, Diana, let me hear your voice.
Wait, I have to find her. Okay.
Wait, she's talking, but there's nothing coming out.
I asked you to unmute.
Unmute.
No, how much is the VIP?
Do you remember? Is it 150? I think it's 150. Yeah.
Yes.
Probably.
Yes, it is. It's 150.
Okay. Thank you. Thank you, Christina.
Okay.
There you
good.
go.
Thank you.
Yeah, you're welcome.
On top of the general ticket, though, want to clarify.
Yeah, it's
You need to
general
buy the
ticket
purchase the
97.
general ticket before you upgrade. Some people are thinking they can buy just that VIP pass, but that's not the case.
So it's still like less. I mean, the VIP pass is under $300, which is a steal.
Yes, Patricia, 150 plus though 97. Yes.
Right. Yep. Okay. I look forward to seeing you in 9 days and whatever number of hours it might be. And thank you. This will be the last webinar we do before it. I've got to shut down the webinar and start to, finish up all the curriculum for the event. Okay. Thank you guys. Bye.